Is postcoital bleeding a sign of cervical cancer? Postcoital bleeding, which is bleeding after sexual intercourse, can be concerning for many women. While it may indicate cervical cancer, it's essential to know that this symptom is often linked to other, more common conditions. In fact, cervical cancer accounts for only about 11% of cases where postcoital bleeding occurs in women diagnosed with the disease in developed countries. This means that most women experiencing this symptom do not have cervical cancer. There are several more frequent causes of postcoital bleeding, especially in younger women. These include cervical infections like chlamydia or gonorrhea, cervical ectropion, which is a benign condition where glandular cells are present on the outer cervix, and cervical polyps. Other causes can be vaginal infections, trauma from intercourse, or hormonal changes. The risk of cervical cancer being the cause of postcoital bleeding does increase with age. Women who are approaching or have reached menopause should be particularly vigilant. In these cases, any instance of bleeding after sex should be carefully evaluated by a healthcare professional to rule out cervical or endometrial cancer. It is also important to note that early cervical cancer often does not present any symptoms. This highlights the importance of regular cervical screening, which includes Pap smears and human papillomavirus testing. These screenings are crucial for early detection. If you experience postcoital bleeding or any unusual symptoms, it is vital to seek medical evaluation promptly. This will help identify the cause and ensure appropriate treatment if necessary. Other symptoms of cervical cancer may include unusual vaginal discharge, pelvic pain, and discomfort during intercourse. While these symptoms alone do not confirm cancer, they should prompt a visit to a healthcare provider. In summary, while postcoital bleeding can be a sign of cervical cancer, it is more frequently caused by benign conditions. Any instance of bleeding after sex should be evaluated by a healthcare professional, especially for women who are not regularly screened or are at higher risk. Early detection through screening remains the most effective way to prevent and treat cervical cancer.